Joining us now to discuss this very thing is Adam Hardage, CEO of Remote Healthcare Solutions. Adam, first and foremost, what is telehealth? What can be done? What can patients have done with telehealth?
Well, telehealth is really an amazing discipline. It originally started with just a phone call to your doctor, and then it became some sort of a video chat with your doctor. And now, as in the case of our company, Remote Health Solutions, we're able to provide a complete remote virtual exam, so a complete diagnostic examination of a patient anywhere on the globe. And we do it for the military a lot. We work a lot with the Defense Department, and we support the chronically ill Medicare patient population. So for us, COVID-19 was just a natural extension of the work that we've been performing for the last few years.
If we're trying to ease the healthcare system and not make it overflow, this could be a big way to do that, to help that. Maybe some are wondering out there, Adam, how do they pay for this? Is this covered by insurance?
Sure, and that's actually a complicated question. I'll just say that yes, Medicare reimburses for elderly, and private payers often pay for services. There are pretty good options out there at this point, especially as the federal government's lifted some restrictions there, interstate-wise and everything else. But the real key for this, the way that people should be thinking about this is, it's kind of like your modern-day MasterCard. Don't leave home without it for the family. So a good example is my wife last week noticed that our son, who's 18 months old, was tugging on his ears, and he's prone to ear infections. And we said, well, we're not going to take him into the ER. We're not going to take him to the pediatricians. We're certainly not going to take him to urgent care. So I got on a virtual exam with my chief medical officer, who was able to use an otoscope that we have in our house that's attached to our virtual exam device. And he looked inside and said, yep, your boy's got an ear infection. I'll go ahead and call it in for you right now. And so within an hour, we had, from the time that we noticed it to the time we picked up the prescription and got my son on antibiotics, the issue is solved. So I think Americans should be thinking about it like that. It's not just for coronavirus. Yes, we need to ease the strain on the hospital system. Yes, we need to isolate and contain the spread. We need to get patients who are infected with this out. We can monitor low and medium risk patients in their homes with a device. In fact, we do this on a regular basis already. We send them home with a device like this, which would have blood pressure and temperature and pulse oximetry. And we've been monitoring COVID patients successfully in that way, so that they do not spread the disease by going into an ER or a hospital.
Adam, real quick, how do you check blood pressure with telemedicine?
Everything's all virtual. So something like a remote blood pressure device would speak via Bluetooth to a device like this, and that would go up to our cloud. Our nurse care team on the back end, whether it's physicians, nurse practitioners, registered nurses, other healthcare professionals, would review those readings, see trends over time, and engage directly with the patient either via telemedicine or notes, direct conversation, telephone, you name it.
Wow, that's impressive stuff. Learning so much. That is Adam Hardage. He is the CEO of Remote Healthcare Solutions. Good to see you, Adam. Thanks for your time.
I appreciate you having me on. Thanks.